All right. So moving on to the next condition for babies when they are still in the womb. This is what is known as fetal distress. So fetal distress is literal. The baby is stressed up. Okay, the baby is stressed up. The baby is not happy. The baby is not happy, So fetal distress is more commonly referred to as what? Non-reassuring fetal status. All right. So non-reassuring fetal status, you can't actually vouch that the baby is doing well. So it's it's non-reassuring. All right. So it's a condition during pregnancy or labor where the fetus shows signs of what? Inadequate oxygenation. All right. It's not good oxygen reaching the baby, or other complications may as well. All right. Things are just coming up that are threatening the existence of this baby. So what is fetal distress? The baby has abnormal heartbeat, all right, shows reduced oxygen, shows reduced movement, experience oxygen deprivation before or during labor. So the term fetal distress is being phased out in favor of more specific descriptions like non-reassuring fetal status, because the possibility of the baby surviving is not clear, so it's not reassuring you understand. So common signs and symptoms is the baby is having some abnormal heart rates, decreased fetal movement, Meconium-stained amniotic fluid. So the amniotic fluid is stained with what? The baby's first stool. The baby is stressed that it has now passed stool in the amniotic sac. The first stool is supposed to be passed after the baby is being given birth, you understand? But the baby is so stressed, had to pass stool. Low amniotic fluid, right? Late deceleration on cardiotocography, right? Fetal metabolic acidosis, right? So causes and risk factors is this. It can be caused by maybe umbilical cord problems, like there's umbilical compressions or prolapse, placental issues, like abruption, previa, preeclampsia or maternal hypertension, fetal growth restrictions, amniotic fluid is too much or too little, prolonged or overly rapid labor, maternal conditions like the mother has diabetes mellitus, or heart diseases, So diagnosis is this: electronic fetal monitoring to track the heart rate, how the heart is going, non-stress test or biophysical profile, fetal scalp blood sampling, during labor. So treatment and management is this. The goal is basically to restore oxygen supply to the baby and stabilize it. All right. So you can reposition the mother, oxygen therapy for the mother, IV fluids just to improve the circulation, amnio infusion. That's when amniotic fluid levels are low. You can now infuse directly to increase it. There's sometimes emergency delivery where you give or do cesarean section or any assisted vaginal delivery. You can use vacuum extraction. You can also use what? Forceps. So that's just the beautiful story behind what? Fetal distress. Okay.